lifestyle medicine, what is that?
Sure. So, lifestyle medicine is a broad term. It's not unique to oncology, but it's the incorporation of interventions in exercise, in diet, smoking cessation that can benefit your health. So, it's
Really? You know, we always hear positive mental attitude really can help. Is that real? Is that true?
sure, it absolutely can be. And, and what gets you to that positive place can be a variety of things. So, as was mentioned, I'm a multiple myeloma oncologist here at the Cancer Center. And what I noticed over time is that in my very short 20-minute appointments, there is not a lot of time to talk about things that are very important to patients beyond their therapy. Some of the questions that I was asked that propelled me to want to have a clinic to address this is, what can I do in my life outside of my treatment to make myself better or to help my chances of doing well with cancer? And so I started to study this. Exercise is an interest and a passion of mine, but to learn more about it. And there are actually very good data that I can talk about a little bit that show that if you exercise, and there are specific guidelines that the American Cancer Society recommends, you can actually lower your risk of recurrence and risk of death from certain types of cancers by doing this. But more importantly, even if there isn't an overall benefit, patients across the board feel better, have improved quality of life, improved mood, lower rates of depression, improved sexual functioning, improved sleep when they exercise and pay attention to quality of life.
So that's a real thing, the positive mental attitude when dealing with illness.
So that's a real thing in terms of exercise. Positive mental attitude has been studied in terms of patient outlook, and that's kind of a whole other ball of wax. It does have some positive data, but exercise and weight management are two separate issues within lifestyle. And so those have been pretty well studied, particularly within breast and colon cancer. And so there have been some pretty impressive results showing that patients who meet the guidelines. So what are the guidelines? The American College of Sports Medicine and the American Cancer Society recommend 150 minutes of moderate intensity exercise per week. So saying that differently, that's 2.5 hours. So 30 minutes a day, 5 days a week, 22 minutes a day, every day of the week of moderate intensity exercise. What does that mean? Moderate intensity means something different. Exercise means something different to everybody. So, what is light? Light is where you're out walking and you can have a full conversation with the person you're with. Moderate would mean taking the intensity of what you're doing up enough so that you can get words out and have bits and pieces of conversation, but you can't sing a song. High intensity, and the other recommendation would be for 75 minutes of high intensity, is where you're working hard enough that you can't have a conversation. And so exercise can mean lots of different things to different people, and many people in this room may have limitations. And another important finding of all the studies is that exercise is safe for cancer patients during and after cancer therapy. Even in stem cell transplant patients, exercise has been shown to be safe. You need to talk to your doctor to make sure you are in a position where it's the right time to exercise, and there may be reasons why it is not. So this is not a blanket statement. But there are very definite recommendations about the benefits of exercise and what you can do. It can be arranged from anything from yoga and yoga can be done easy, medium, and hard. Stationary bicycling, outdoor bicycling, walking. And exercise can also take on forms. It does not have to be done in a gym. And in fact, what I've learned from my experience in the lifestyle clinic is gyms are expensive places. They can be scary places for people who worry about risk of infection. So what I really like to look for are things that are free and things that are accessible and things that might not expose patients to germs. We've actually come up with a series of 8 exercise videos. I don't know if people here know about that, but here in the lifestyle medicine program, working with a team of physical therapists, rehab physician doctors, we've put together 8 exercise videos.
How accessible are those videos? How can they get them?
They're
How
on
can
YouTube and they're on our website. So if you Google exercise videos, MGH and cancer, you will find them. We can even
we have a
cue 'em up.
sample video here, right?
Yeah, we can. Here they are. So here we can cue them up.
Nice big long kickstand as you come out. Every time you come up, exhale, inhale, exhale. Yeah, good breath, Jeff, really good. Big deep breaths. You got about 10 more seconds on this side, and then we're gonna go into a punch. So you got 5, 4, 3, 2. Nice. So everybody's going to take a nice wide athletic stance, bend into it just a little bit, and
Ow.
you're just going to start to punch. Good. So right here, you're taking big, deep breaths. Working all those muscles in your upper body actually gets your heart rate up really high. And if you've got stuff going on with your
And so you'll
shoulders,
notice
a good
one of the
idea
women
to
in the
pause
back.
that. And Jess will show you. It'll either be to punch
Most
low
of these
or
people
keep your
have
hands
cancer
under your neck.
diagnosis. We've got a woman in the back with a lymphedema sleeve. We've got several patients in this video who are either undergoing cancer therapy or have gone through cancer therapy. The woman in the front, so to your right, is a physical therapist here at MGH. She modifies all of the exercises, so there's no jumping for someone who might have a not weight-bearing limitation. So these are available on our website. There are 2 easy, 2 medium, 2 hard. There's a yoga video, and there's a cardio dance video, which is really fun. It's the
And
best
this
video.
really eliminates one of the big challenges, I would guess, that initially, mentally, where patients are
That's exactly
with
right.
the journey, so to speak, they're afraid to go to a gym. They're afraid to take that first step.
Yep.
So this immediately gives them a community of peers, so to speak, to start with.
That's right. And on the website, on our webpage, for those who are not exercising, we have a 4-week build-in program so that you can start with walk. You can try one of the easier videos the first time, take 2 days off. You don't need to jump right into a half hour. In fact, that would probably be the wrong thing for someone who's not exercising currently. But this is a resource that's available. And then there's a 12-week program as well on our website to really guide patients back
Now,
through
how
this.
layered is it? Like, how do you go about recommending a certain workout program for a certain patient? That must take a lot of research
Absolutely.
to make sure you're not.
That's exactly right. So any patient who's thinking about exercising should start if they're not currently doing so. Some people already are and they can continue to do what they're doing, but if this is a new or foreign concept, or maybe you've been through a surgery or in a different place, never exercised before, first place to start is to start with your oncologist saying, I've heard that exercise is good for me. Most of your oncologists should know this, and say, how do I start? Am I safe to start? Do I have chest pain or shortness of breath with exertion? These are things that might be, red lights before starting. But if cleared, there are actually a lot of resources. I'm not sure if everybody out here knows, but you can actually be prescribed physical therapy. So that's a billable cancer-related fatigue or cancer deconditioning. Those are diagnostic codes that can be referred to physical therapy, and you can see a physical therapist here or in your community who can help you get started, who can do some assessments. Very important things are muscle stabilizers, just for getting out of a chair and walking. And if you're in a hospital for a prolonged period, those might be weakened. So that's a safe and good starting point for someone who's never exercised or become very deconditioned.
Well, they may just feel defeated
That's exactly
by the experience.
right.
Yeah.
And then my clinic obviously is another resource for people who want to talk about these things. We also have a cancer rehabilitation physician here, a doctor who is trained at Spalding. And so we have a great team here to address those needs. And I don't know that all of our cancer patients necessarily know or hear about it, because it's not as, we're always talking about treatment.
Well,
But
they're hearing about it now.
That's exactly right. But there are a lot of resources out there available for patients.
Show of hands, how many people are in a workout program of some sort, exercise? Good for you guys. Keep it up. Good for. How did you end up in this field?
So it's a great question. So, my background is in sports. I played sports through college, was in the fellowship program here, and there was a lecturer, a doctor who is a physiatrist at Sloan Kettering, who's the leading person probably in the world in exercise research. I heard him talk to our breast group, and I said, now that is something I can relate to. And I have had so many patients ask, what more can I do? And I really felt that it was an unmet need to really talk about these things for the people who are looking for it. And so I began.
Well, you kind of transitioned your personal passion into your professional job.
Exactly.
Oh, that's a win-win.
Absolutely.
Is there like a gym in the building?
No, but we need one.
Oh, sorry.
Exactly, it would be great
Oh, boy.
someday.
The finance office is going to hear about this in the morning.
We're confined. We have a big building going up,
Yeah.
and we may be seeing great things. So
Yeah,
it'll be
I'm
very
sure the
exciting.
finance office is going to be. Could you tell Billy to keep his ideas to himself?
Exactly.
No, really. Do you have a cycling club?
I do. I'm in a couple of them, actually.
Oh,
So
good.
I'm on Team Psycho, which is a triathlon team. I ride with the Monster Cycling Club, and I race with 545.
Good for you. All right. Let's get some questions.
This is a wonderful program, and I recommend this to a lot of my patients because it's a free resource. So if you go on the YMCA website, or if you Google YMCA and Live Strong, it will give you a map, and you can put in your zip code, and it will identify the closest programs to you. It's a 12-week free program. You're guaranteed a personal trainer at least once per week. In addition to that, there's the Cornerstone program on the North Shore YMCAs, which actually is kind of another evolution of this. They'll give you a full year membership for 1 year for both you and your family.
Wow.
And provide childcare. So the YMCA is a wonderful resource if you live in the North Shore, so that would include Beverly, Marblehead, those Ys all offer that Cornerstone program as well.
Why am I not surprised the YMCA is doing stuff like that?
It's amazing. I mean, the programs up there are really fantastic, as is the Live Strong program. Thank you so much for raising that.
Yeah.
You know,
makes
so that's
sense.
such a great question. When do you push and when do you not push? And so it's hard to answer as a blanket statement because cancer treatments are so varied and patient experiences are so varied. What I can say more generally is that one of the greatest things that people struggle with is cancer-related fatigue. And paradoxically, almost, the best and only proven treatment for cancer-related fatigue is exercise. So sometimes if you're just tired and worn out, maybe it's time to push yourself. But if you're at your count nadir, that low point from chemotherapy, or you've had a recent illness as a result of treatment, that may be a time to sit out. So it's a little bit variable, but it's a great point you raise. Thank you for asking. So the Lifestyle Medicine Clinic, if you're interested, is on our webpage for MGH, and there's the numbers on the webpage. 724-4000 would also work. And I also want to say that our Lifestyle Medicine Clinic is expanding, and so we'll be offering that service at Waltham and at Danvers as well. My colleague Lauren Winters, who is a breast cancer nurse practitioner and a certified cancer yoga instructor, will be offering the services at Waltham. And Sasha Knowlton, who's a rehab physician, the one I mentioned, will be offering them at Danvers. So trying to make it more accessible to patients.
And do you organize groups of patients that can do it together and might make it more comfortable?
So that's a great question, and that is kind of our next phase, particularly around nutrition. That's the one thing we didn't talk about, but I think is a very important discussion is, you know, some patients lose weight during their cancer treatment, but the majority of patients actually gain weight or have changes in their body composition where they lose the lean muscle, good mass, and gain fat, even if their weight doesn't change. And so a lot of patients I see want to know how to lose weight. So we've heard you, and we're really excited. In the fall, we're going to have a nutritionist who's dedicating her time to the Lifestyle Medicine Clinic. And we have nutritionists now at the Cancer Center. Every cancer patient is guaranteed one visit with a nutritionist. And so that's another thing we offer. And we're looking to offer classes as well, particularly for
Glad
weight
I
loss.
asked. Boy, you guys are touching all the bases.
Absolutely. So, you know, that's a great question. And we don't have resources listed on the website. What I typically do is when I meet with someone, I learn where they live. I try and find out what their interests are and help find them those resources within their community. Livestrong is obviously a nationally available resources. These videos are free and accessible. MGH, they're on the Lifestyle Medicine, the survivorship website. If you Google it, they're on YouTube. So MGH cancer videos, they should be findable pretty easily. So yoga can be great, and it really depends on what your level and ability is and the type of class you take. So there are a variety of different types of yoga and a variety of different intensities. So, you know, the nice thing about yoga too is it works on both strength and flexibility. Usually in a class where there's some amount of instruction, there are corrections to prevent any form of which I think is important. And you can certainly increase the intensity to the point where you're sweating you take and your level. And I think that's one of the nice things about yoga.
I'm going to throw out, in 1 second, I'm going to throw out one more suggestion. There's an organization I work with 2 or 3 times over the course of a year out on the North Shore. It's called Sailing Heels.
Bring that up. Yeah.
And they're doing wonderful work. We do a series of fundraisers during the course of the year, and they actually round up people who own beautiful sail yachts. And for a full day, they go out and they take patients out, and you spend the entire day out on the open water. And
That's a great question. And, when we were talking about the American Cancer Society recommendations, I gave you half the information. So you've just given me the opportunity to give you the second half. So 2 days of strength exercises are recommended. And so what are the important muscles to focus on? They're the muscles in your thighs, your quadricep muscles, to help bring strength and stability, and also your rear end muscles, your gluteus muscles, because what we really don't want to see is patients fall. And so if patients are older and frail, the loss of the core muscles are the critical ones to focus on. There are some free apps. The 7-Minute app is a free app that does strength workouts. It cycles through in 30-second intervals, so you can't get bored. And everybody has 7 minutes. You can even do that every day. But the key is to focus on trying to get 2 to 3 sets of 10 repetitions of core quadriceps, those things like squats. And that doesn't mean with weights. You can do that, up and down in a chair, against a wall, focusing on those core stability muscles. Oh, that's so awesome. So that is so wonderful. The one program I do know about, if you're on the North Shore, are those WISE, but anybody can have access to those. The Cornerstone program, it's not, you don't have to live in that area, you just have to be able to get there, would absolutely offer a membership to a spouse for the same duration of time with the same privileges. But there are a lot of things that people can do together, and I think you've underscored a really important point here, is doing exercise with other people, having a community, having a team, whether it be in the form of classes or partnership with a person. So a lot of activities, whether it be videos, walking, a yoga class. If you can do it with somebody else, it will only enhance your experience and potentially the safety too, if there's a concern.
And that's what's great about your videos, is you instantly have a group, but you don't have to go anywhere.
That's right.
All right, folks, how about a nice round of applause for Dr. Betsy O'Connell?